Hello, my name is Karina Clements, and today I want to talk about ethical issues in research and how we communicate in healthcare, especially for those of us that are working in allied healthcare. First, I'm going to go over what scientific communication means. So, when we share research or health info, we need to make sure four things. So, first, that it's accurate. The facts need to be right. The second is that it's clear, easy to understand, honest, so we don't hide anything or stretch the truth. And then lastly, that it's professional, so respectable and reliable. So now let's talk about ethics in research with people. So as healthcare workers, we need to protect patients and do what's right. So this means, first of all, getting informed consent. So our patients need to agree to be part of research and they need to understand what's happening in order to actually consent. Second, keeping privacy and confidentiality. We don't share personal info. That also goes against HIPAA. And then also making sure that the research is safe and fair for everyone involved. There's also ethical problems in how we communicate during research. So we shouldn't ever lie or hide things from participants. We shouldn't exaggerate the results to make it sound better than they are. And then we need to respect different cultures and explain things in a way that makes sense to all. So if there's a language barrier, then that's not fair to the patient. And we need to make sure that we explain that in a way they can understand. Good communication is important in everyday care too. So to talk well with my patients, family members, and also coworkers, I personally use simple terms that anyone could understand because a lot of times we get a little too comfortable using medical jargon, and not every day do our patients use those words. So I like to use simple terms that everyone can understand. I also listen carefully, just active listening and being kind. And then lastly, especially with coworkers, working in a hospital, we work as a team, speak up when needed, and then also using tools like SBAR to stay organized. Also, writing professionally is another part of the job. So emails and reports, I make sure to be very clear and respectful. A big thing, especially as a nurse, is to keep things short but complete. So in like any nursing note, I will make sure that I do as much detail as I can while also keeping it simple and not overdoing it. And then checking for mistakes before sending too is a big one. And then lastly is professionalism. So how we talk, act, and dress matters. I always try to speak clearly, look presentable, and show everybody respect when I work with them. So then lastly, to wrap it up, ethical and clear communication helps keep patients safe and builds trust in healthcare. When we stay honest, kind, and professional, we make a big difference. Thank you.